this course outline. Extemporaneous compounding and small-scale manufacture of pharmaceutical products. Then we'll look at types of dispensed preparations, which you've done in pharmaceutics and so on. Then packaging and labeling of medicines, dispensing techniques, equipment, good dispensing practice, the major routes of drug administration, which you've also done in pharmacology and should be pharmaceutics, then patient counseling, adherence, compliance, and concordance. So to begin with, we'll look at what extemporaneous preparations are. Then we move into extemporaneous compounding. Let me give an example. You receive maybe a prescription of hydroxyurea for a child. Now, a child we know can only take a suspension or a syrup, maybe a child of less than 5 years old. So when you receive that prescription, in stock you find that you only have hydroxyurea 250 milligram capsules. And there are no hydroxyurea preparation in suspension form. So what you need to do is to compound. You measure based on the prescribed dose or dosage. You do the calculation. What is the amount of hydroxyurea powder that will be required for you to prepare the syrup or suspension? After you've done that, meaning you are going to individualize the dose. You know the child's dose is this, but I only have 250. So you reformulate that powder into a suspension or syrup. Once you do that, you use whatever syrup is available, maybe multivitamin syrup, and dispense that to the patient. That process of you reformulating the powder into a suspension is what we call extemporaneous compounding. So when you compound, you have to dispense to the right patient. So extemporaneous preparations, therefore, are prepared when the actual prescribed, okay, when it's not available, that's when you can prepare. There's no way a patient comes to the pharmacy looking for amoxicillin, 500 milligrams, TDS for 7 days. Then you have it in stock, but you say, I want to reformulate or prepare a 500 milligrams. I know in stock you have 250, but you say, I want to prepare 500 milligrams. We rent extemporaneous compounding in pharmacy practice and supply chain management. So let me shine. Then you get the capsules, open, put the granules in the beaker. Another one you get, it makes 500 milligram. You even add your syrup and so on, and then dispense. No. If you have 250 milligram in stock, get 2 capsules therefore to make 500 milligram. You have depackaged, and it's also sometimes under extemporaneous compounding. So most of the products that are are prepared in compounding are usually used for skin infections, some solutions and suspensions for oral use, and so on. Those are the major products that are prepared in a compounding room. Okay, but there are main factors that we should consider when we are compounding these pharmaceutical products. So we'll look at these factors, I think, on the next slide. Sometimes when you see me stop, know that I'm struggling to add some people. I try to add, they go out, I add, they go out. So some of the factors you need to consider when you are preparing these products or extemporaneous preparations. The use of the product. Is it for dermatological conditions? Then the safety and suitability. Is this suitable for use? Is it safe? Because we will not prepare a lotion for oral use. No. Lotions, we know they are for dermatological conditions or creams. So is it suitable? Is it safe? Then calculation of formula for preparation. Now this number 3, I think we have labored too much on how to calculate formula. What we are doing to calculate, you have been given this and this. What quantities do you need to add to prepare? Some of them may come as reducing formula or enlarging formula. Others may be in form of increasing or reducing concentrations and so on. Then the method of preparation. Consider the solubility of a product wherever possible. Do you need to add a vehicle or a diluent, a preservative, flavoring agent, and so on? For example, if something is for the skin, do you need the flavoring agent? No. But usually, oral use, you need a flavoring agent. Injectables, do you need the flavoring agent? No, you don't. Preservative is usually needed so that the active ingredient is preserved until such an expiry date or shelf life is reached. Okay, then the choice of container. Certain products are meant to be packaged in a certain container. Some products are sensitive to light and therefore must be maybe prepackaged in or packaged in a light sensitive container, a colored container, so that light does not penetrate. Then the label. Consider the label. How is it going to be? The title of the product must be there on the label. For example, calamine lotion, BP. Calamine lotion, BP. That's calamine lotion, British Pharmacopoeia. Meaning you use the British Pharmacopoeia to prepare this product. Remember, there are main pharmacopoeias. We have the British Pharmacopoeia, the United States Pharmacopoeia, and so on. So these pharmacopoeia, the ones we use when preparing a product, on the label, you add the title. Okay, and it should also show the pharmacopoeia used. Is it British? You find BP. Is it US, United States? You find USP. Okay, so when you find those British, don't think no BP. This one, it means blood pressure. No, doesn't mean blood pressure. It means British pharmacopoeia. Then the quantitative particulars, product specific cautions, directions to patient, the recommended BNF cautions, discard dates, sample label, storage conditions, advice to the patient. So what I'm saying is, on the label, make sure the amount or the quantity that will be dispensed is fully shown. Cautions must be there. For example, do not take, do not take, or only, for external use only, meaning it can only be applied. Okay, then cautions for each product, check in the BNF. There are cautions which are which have been stipulated. An ointment, for example, it has got certain cautions, like I was saying, maybe do not expose yourself to sunlight because maybe this product is sensitive to light. So when you apply, you make sure you're indoors. But maybe during June, like this one, during May, June, and July, when it's very cold, even if you apply, you can walk around outside to see the sun, or in the evening around. But during day, you find that you're not supposed to expose yourself to sunlight once you apply or take a stain grad. The discard date for a preparation, once you have prepared and you have dispensed, you have to show when, if you prepare it today, you have to show that on a certain date, this has to be discarded. Okay, so do not use after this date, you indicate to the patient. Then storage conditions, of course, maybe you tell the patient or the client to say, store this under cold temperature, store this in a refrigerator, store this under room temperature. Okay, so all those conditions must be put there based on what you see on the pharmacopoeia guidelines. Oh wait, let me add some people. All right. So for some preparations, you can see the discard date here. You see that for some preparations, like those which are applied, 4 weeks. So when you prepare, you even include, so from today being the 26th, 4 weeks add 28 days to this date. So you find maybe by around 20th or 22nd, or 24th or 26th, it cannot be used beyond that date. For capsules, the ones you pre-pack, 3 months. Creams and gels, 4 weeks. And some of the cautions or important things that must be there, for example, you specify that this is for external use, this is for external use, and so on. Then the type of container there is also shown. Amber flatted bottles, amber glass jar, and so on. So we proceed. Oof. So what are some of the types of products that are dispensed? We have suspensions, emulsions, ointments, solutions, creams, gels, capsules, tablets, and so on. All these preparations, unless you have never done them, can someone confirm that these have not been done in pharmaceutics, pharmacy practice, or pharmacology? Chris, have you covered this in class?
Yeah, yes,
Chris?
the suspensions, emulsions, we have done like some of these.
All of them.
Creams, I won't doubt creams and just because all these like cups, tablets, these are the ones we are doing just now.
Or under dosage forms? Dosage form preparations.
That's the ones.
Okay,
Yeah,
okay.
in
So
pharmaceutics, that's the ones.
okay, so you cover all these. So we cannot cover them twice. Okay. So look at each preparation.
Okay.
Yeah, each preparation, the uses of the preparation, the advantages and disadvantages of this. Why is a cream?
Okay, sir.
When is the cream required, or when is a gel required? When do we need a paste or an emulsion? In what conditions can you use them? And how do they? What is their physical stature? For example, which of these is more thicker than the other? Which one has got a higher viscosity than the other? Which one is more like maybe a suspension or a solution or a liquid form? Which one is semi-solid, and so on? You need to know or identify them that way.
Okay, sir.
Yeah. Then we move on. So these extemporaneous preparations, we need them on demand. For example, like I said, we have these capsules, but what is needed maybe is a suspension or a syrup for a child. We need to calculate. You guys are now experts when it comes to calculations. You are told we need this child to take maybe 125 milligrams. And you have those 250 milligram capsules. Of course, you know that I'll need half of a capsule. If it's 125 milligram OD for 10 days, I'll need half of a capsule per day. So how many capsules can I add in here? For 10 days, it means I need about 1,250 milligrams. So that's basically 5 capsules. So I'll get 5 capsules, open them, put the granules in a beaker. Then I get the required syrup. I measure the syrup and add in that beaker. Then shake, prepare, and put the label. Remember, before I even start preparing anything, the label must be written. The label must be written because, for example, if I have to wait for the preparation without having the label in advance, I may end up labeling a wrong product. In case I'm preparing, another prescription comes, I may end up labeling something wrongly. So what I need is to prepare the label in advance, so that as the preparation is done, we just put the label on that preparation. So we need this, or we do compounding of these products on demand because we do not have the required drug, okay? And we tailor it based on the physician's prescription. And each of these preparations is different. It's based on each individual patient. Like I was saying, there could be many patients who require hydroxyurea. But if I say, hey, everyone requires hydroxyurea, therefore, I will not even prepare labels. I'll just prepare and label later on. No. One may require 100 milligrams of hydroxyurea. The other one may require 50 milligrams. The other one may require 200 milligrams, and so on. It's individual patients. And that's why the label must be prepared in advance. And when you are just done preparing, get the label put. Then dispense for that patient, start the other one. Okay? So you find that in extemporaneous preparations, usually we prepare very smaller quantities of products. Okay? When we compare to manufacturing, manufacturing of drugs, it's actually where you are preparing or manufacturing a large quantity of drugs. So you have got maybe antibiotics, analgesics, and so on. All those being manufactured at a large scale. But when we come to extemporaneous preparations, these are smaller preparations which are tailor-made based on individual patients and responding to a physician's prescription. Okay, so why do we need to do compounding? I think I've explained most of these things. Some children, or I may say, we all differ. A child and adult cannot take the same strength of a drug. The drug may be available in an adult form, but we need it in a child's form. And that is why even you guys had to calculate certain dosage forms. I gave you something to do with a child's dose. So if an adult dose is 500 milligram, what dose does a child require? So you do the calculation based on those formulas. Okay? If there are tablets which are available or capsules, a child may not be able to take those. So prepare it into an oral solution or suspension, which a child can take. Okay? Then, certain capsules, for example, maybe gelatin, the gelatin part on the capsule, because you have a capsule, that part outside, that's gelatin. Some people may react to that. So you find that either an adult or a child may react to the gelatin part. So that can be removed. And then that can be removed. And then the granules pre-prepared or reformulated into a suspension or a syrup. Okay? And then certain, yes, Mark Lawrence.
Sir, now that you have talked about a capsule which can be disintegrated and then converted into a suspension, how about that practice we used to do when we were young back in the village, where you break a capsule and maybe put directly on the wound? Is it also recommended?
I don't know, Mark Lawrence. Can you answer for me? How do you feel? You are actually a practicing pharmacy personnel.
No, I'm asking for your friend, sir.
For that one. You're asking for that one?
Yes.
Okay. Clinically and ethically speaking, to open a capsule and remove the granules put on a wound is not correct. But I don't know whoever came up with this thing. Seems like it works. Seems like it works because I've seen most people actually open, get the granules put in a wound, and then the wound actually heals faster. Traditionally, or in a lay person, I think it does work, but clinically speaking, it's not okay. Clinically and ethically speaking, it's not okay.
All right, sir. No, thank you so much.
I see, Mike Lawrence, that's what you do, right?
No, 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 I don't.
You are the one
I've
who
just tells
also,
many lies, people.
you also crush the Septrin tablets into powder and then you put somewhere, right?
No, no, no. That I don't.
Okay. The latter you don't, the area you do. So these preparations can be used in pain management, compounding for animals. So we are trying to tailor based on the individual patient, okay? We create a dosage based on each individual patient. So all these extemporaneous preparations must be suitably packaged and adequately labeled. So I don't want to hear that they must be packaged and labeled. No, they must be suitably packaged and adequately labeled, meaning the label must be a good label. We don't want to see a label where you have written in very small letters, very small, such that it's only you can see. And the reason you can see is because you know what you're writing about. Us who don't know, we get lost. Must be suitably packaged and labeled very, very, very adequate. So when you package these products, it maintains their safety, their quality, and stability. Imagine you prepare hydroxyurea, and then you just put it in a cup. Say you are going to use this for 1 week or for 10 days. After that, you come back, we give you another one. Imagine what will happen to the drug in the cup. Exposed to oxygen or moisture, exposed to contamination, therefore bacteria will be able to go in there, exposed to sunlight, and all kinds of things. So you make sure it's well and suitably packaged, okay? And like I said, a label must be prepared before you dispense a drug, or before you prepare a drug, a label must be already prepared. The reason is, I'll repeat, you do not want to give this drug maybe to a wrong person, or you may not need to put the label on a wrong medication, or if you come and label on the container, the label may not be able maybe to attach there, or some liquids may spill on the label, and nothing will be seen. So just prepare, put it aside. Once you have done your product, clean the container nicely, attach the label. Okay, so we are saying even the container itself must be very clean. You clean, then you put the label. Okay. So what containers do we need for packaging of these extemporaneously prepared products? We have what we call tablet bottles, medical bottles, ribbed amber medicine bottles. So for tablet bottles, I think when I give you the notes, you'll be able to see the types of bottles. You'll see how they look like and so on. But in here, I've not put them, but in your lecture, in your study notes, you'll find them. So they are either made of glass or plastic and amber colored to reduce the action of contents with light. So I said why containers are colored, to reduce penetration of light. So these bottles are used usually for capsules and tablets, and they contain what we call child-resistant closures whenever possible. These closures make sure that when you close, any child will not be able to open. Because you know, children, if a container is easy to open, a child can open and actually take all the drugs which are there, and they go into toxicity. Medical bottles, these are used for liquid preparations and have also what we call child-resistant closures. Take note of certain syrups for children or suspensions. They are very sweet, they are very flavored, such that if they do not have a child-resistant closure, a child may easily open and take the entire syrup or suspension at once. Some of the suspensions or syrups, once taken at once, may cause adverse effects, or the child may go into toxicity until you seek medical help. So we should take note of this. Then we have the ribbed amber medicine bottles. So these, they look like the medical bottles, but the difference is that they contain ridges around the container or the bottle. So those ridges move from up to the bottom of the bottle. And mostly these are not used for preparations to be taken orally. So on the label states for external use or not to be taken. Because when you say not to be taken, it means it shouldn't go inside the body. It means it's for topical use. So it is important for us to put an adequate label on every preparation. Okay, so these are used for external preparations such as liniments, lotions, gels, liquid antiseptics, and so on. And it's good that you're covering this part in pharmaceutics as at now. So these bottles, like the medical bottles, amber medicine bottles, the ribbed amber medicine bottles, they are bottles which come in sizes of maybe 50 mils, 100 mils, 150, 200 mils, and so on. So even on the bottle to show the quantity, 50 mils or 100 mils, both the medical and the ribbed or flatted amber medicine bottles, they have such quantifications. And that's why when you buy a syrup, you'll find it's written 50 mils or 100 mils. These are the bottles we are talking about. Then we have calibrated containers for liquid preparations. They have those marks, for example, at 50 mark or 10, 20, 30, 40, and so on. So let's continue from where we ended from. So I was talking about calibrated containers. So you find some of them that are like conical flasks and so on, or cylinders and so on. They contain those calibrations. So usually we use these for high dense suspensions and emulsions. The reason being that for a smaller bottle like a 50 ml or 10 ml bottle, when you're removing the drug or when you're transferring the drug, it may be difficult for you to transfer because most of the drug may actually remain stuck to the walls of the container. So that's why we use these bigger calibrated containers. Then we have what we call cartons. So cartons, they come in a rectangular shape. Usually they come in different sizes. There are some which are very small. If you know a strip of a drug, of a medicine, for example, a strip of paracetamol, a strip of metformin, a strip of amoxil, a strip of cephalexin, and so on, where those strips of medicines can fit, may be very small, maybe where 3 can fit or 6 can fit. And usually they come unlabeled, so they don't have anything to indicate that this drug, which is here, is this. They are meant for us to say when we want to dispense, we put the drug inside and then we label. And the label must be very adequate, like I was saying. So you label on the larger side of the box, because it's rectangle. You know, rectangle has got two bigger sides and about how many? Two smaller sides. So on the bigger side, you put your label. If the label does not fit on the bigger side, you make sure you also trace the other side of the container. These, they do not have child-resistant closures. Remember, it's just a box. So when you dispense to the client, make sure you tell them that additional care must be there. Because if you leave it on the table, leave it in the living room, the child is going to get it. They will open and consume the drugs which are there, which are inside. Then we have ointment jars, also which come in different sizes, but they are made up of either colorless glass or amber glass. So amber glass, the reason being that the preparations are sensitive to light. Unfortunately, they also do not contain child-resistant closures. So emphasis must be there on storage, on how they are secured, safety, and so on. Then we have collapsible tubes. Yeah, collapsible tubes. These also come in different sizes, used for creams or ointments. I'll not explain what a cream is or an ointment. I know our doc is doing a good thing there. So these also do not contain child-resistant closures. Same reason applies. Much emphasis must be taught to the patient or the client on how to keep or store those in the house. So correct labeling is very, very cardinal in dispensing. For medical bottles, the label must be in front, on the front side of the bottle. For ointment jars, on the sides of the jar. Cartons on the larger side. I think I explained this in advance. And you make sure that the label must be clean, not just the label itself, including the container. This container must be clean inside and outside. Inside, to avoid contamination of the product, the one you're going to put there. So it must be clean. Outside, make sure it's clean, because if it's dirty, the label will not attach. It can just pseudo attach. You know what I mean to pseudo attach? Huh? Pseudo attach means once you prepare, when you prepare and attach it, it will show that it has attached. When the client goes, they reach home, the label comes out, or before they even reach home. Okay, internet went. Yeah. So when the client goes home, before they reach home, or when they just reach home, or after a few hours or days, the label will come out. Pseudo attaching. So make sure the container is very clean. Okay. Secure the label before dispensing. Okay. I'm explaining this label must be put on a clean part of the container. You make sure there is no dirty, there is nothing like grease on it, because that is going to make this label come out. It will just rip off. Okay. Then the information on the label must be legible, concise, adequate, intelligible, and accurate. Legible, we are saying write the information that someone is able to understand. Someone that is able to read. The information must be readable. Someone is able to read. Someone is able to understand easily. Okay? And don't like information that is going to hurt someone. Simply because it's a skin infection, then you start saying, oh, on the label, because you have this skin infection, make sure do not share a bed with someone. Do not be in contact with children, because you're going to transmit this this condition and so on. Don't make someone feel bad about that their condition. So concise, be straight to the point on your labeling, and it must be adequate. Like I was saying, if on one side where you are writing the label it's not enough, you can also go to the other side of the container to make sure that the information there is adequately written. And don't write things like very small things that someone will not be able to see. No. Intelligible, very plain English must be there. Not using ambiguous words. Which word can you say as ambiguous? On a label, you are dispensing to a client. Which terms can we call as ambiguous? Because you want to show that I'm a learned pharmacist from the University of Zambia. Which terms do you think can we call they are ambiguous? Are we there?
Yes, sir.
Yes. Okay, it must be accurate. Then these labels that we are going to put when you are dispensing, make sure they have the patient's name, preferably their name, their full names, their title, for example, Mr. Christopher Mbao Mlenga, then the date of the prescription, or the date when this product is going to be dispensed, the name and address of the pharmacy, and also a warning, for example, keep out of the reach of children, so that parents know, or the guardians know, that children should not access this product. Okay, the name of the product, the strength, and the quantity must be there. For example, amoxicillin, or I say paracetamol syrup, that's the name, paracetamol syrup, BP, 125 milligram per 5 mil, that's the strength. We're talking about concentration, and the quantity, 100 mils. You ensure those are there. Then, if a product is for internal use, it must state so. It must state so. If it's for an adult, then when you're writing your label, you say, take 10 meals 3 times a day, etc. Okay? If it's a child, you say give, because you're not going to say take. Sure, the child is going to read to say I take. No. Adult, sure, take. For a child, sure, give. And it should also state, is it a syrup or a suspension? Okay, so you can label that. Okay. So the strength can be stated as this. For example, 125 milligram per mil. We don't show that the paracetamol syrup 20%. It's us who understand the 20%. Other people don't understand. As we know that 20% means 20 grams per 100 mils. Other people will not understand that. Okay, so all that information must be put on the label. This is what I'm talking about. Sodium chloride, 4%. You don't say 4%. We say the solution, of course, the name. For example, this name here, solution, and its strength, each 10 ml dose contains sodium chloride 400 milligrams. So this is 4 grams in 100 ml. So 4 grams in 100 ml, if you have to convert again, it can take you to 400 milligram. Then you state freshly boiled and cooled purified water to 100 ml to 10 ml. So it means that you weighed 400 milligram of sodium chloride and put in a container. Then after that, you boiled water and cooled it. Then you added up to the mark of 10 ml. So that's your preparation. Then external use products must be labeled, not for oral use or for external use only. Make sure that labeling is there. So even state the name of the product. For example, sodium bicarbonate ear drops or sodium chloride mouthwash. And then, is this product a nozzle drop? Or is it an ear drop? Or mouthwash? Or lotion? Enema? Or what is the intended use? It must be stated on your label. Okay, this is an example. Sodium chloride BP, that's British Pharmacopoeia lotion, 4%. So the 4%, it means that it's 4 grams in 100 ml. So the lotion you have stated containing sodium chloride BP 4 grams, freshly boiled and cooled purified water to 100 ml. So 100 ml, that is, you got your 4 grams, put in a bottle or container, then added freshly boiled cooled water up to the mark of 100 ml. So you then after that you do the shaking of the contents, make sure it is well mixed, and then you label and prepare and give to the patient. Expiry date, I keep on repeating, must always be there. Remember, you need to know the expiry date of a suspension, of a syrup, of a cream, and so on. So it should be stated on the label. Then this expiry date, it's better actually you put discard after, or do not use after. Do not use after, discard after. So for example, discard after 30th June 2020. So meaning 30th June is the last day for you to use. After that, you discard. What about the suspensions like cloxacillin suspension? How many days do you keep it? I've seen people keeping it for 1 month, actually even in 6 months. When after preparing, how long do you keep it? Or amoxicillin?
I think it's supposed to be after 7 days.
So it has to be after you prepare, after you have prepared, you keep it for only 7 days. After 7 days, you discard. The efficacy, effectiveness of this product is lost after that period. Then warning labels must be very clear. We've been talking about warning labels, external use only, for vaginal use only, rectal use only, do not swallow, and so on. Okay, I think I've labored too much on this. Inhalations not to be taken, nasal drops not to be taken, suppositories for oral, for rectal use only, pessaries for vaginal use only. Their husband, their boyfriends, their sugar daddies, and so on. Or if that's if they fail to insert for them. But if you found me in the pharmacy, I'm dispensing, and then you're looking for a pessary, I'll just read for you to say, you see the leaflet? This is the leaflet. Able to read? Yes, okay. Follow the leaflet. Okay. Okay, we move on. Yeah, we move on. So that's it about pessaries. Alon, I beg you in Jesus' name. Huh? Alon, Mr. Mkandawire. Then who is going to work at the pharmacy if you follow them at home? Hmm? Anyway, let me move on. We'll come back to dispensing a pessary. It's if the meeting comes to an end, we'll come back. Remind me, okay? And each one of us will say how they can how they can help someone instead. All right. So, as a pharmacist, this knowledge must be on your fingertip. Krisha wants a division. Okay, we'll revise. We'll revise. This knowledge must be on your fingertips. We don't want when a client comes to you to get a pessary, you don't know how to advise this patient or the client on the uses of a pessary. First of all, some of them will actually ask you to say, what are the uses of these pessaries? So how do I insert? Let me tell you again. There was a client who went to the pharmacy in a public hospital actually. They prescribed a pessary. Now, the pharmacist didn't explain to the client on how to insert the pessary because it was a pharmacist like Marupenga Peter, feeling shy. Chris is not here today, so no one to tell you. Okay, gave that client a pessary. What did the client do? When they reached home, because these pessaries, they come prepackaged in certain a bit thick or hard plastics. So the client removed one pessary because they will come demarcated. So removed one, but it's still in a plastic, and she inserted it together with that plastic. Why did she insert together with the plastic? It's because like a person like Peter. So Peter, you need to change.
Sir, just a quick comment, sir. Yeah, it's true that maybe I would have failed to explain, but I'm not alone. There are a lot of us here who want this revision. Christopher, Tricia, and maybe also me. So for our sake, so could you do a quick revision so that, because it's like people really want to know how to dispense this thing so that they'll be able to give the patients good advice.
Okay, so what happens when you receive a prescription? I'm going back to those steps. When you receive a prescription, you validate it. You make sure the name of the patient is correct and the gender is correct. Imagine it's a male who has come with that prescription and you haven't validated. The only thing you do is get the prescription and dispense. Oh, clotrimazole, pessaries, 1 OD at night for 3 days or 7 days, you dispense. Hey, now this guy is a man. How is he going to use the pessary? And that's why validation is important. Validate. Make sure that, oh, this is the right person. Okay? You are giving to the right person. Imagine it's a pessary, and then it's for the doctor was confused and he wrote a pessary for a 2 months baby, but he wanted to write clotrimazole cream, meaning for the skin, but wrote clotrimazole pessary. And when they come, you just come and give the client. Then they go home only to find out to use it's a pessary. Then they remove. They will, of course, inserting, inserting, thereby ending the virginity of a 2 months babe. So it is important that you validate the age, the gender, everything that is supposed to be there. Interpret the prescription. Make sure you know the uses of the medicines on the prescription and also why it has been prescribed. Okay, then you prepare your drug. In this case, you get the suppository. Then remove. Check on the leaflet if you are not sure of how to use. So advise the patient, if it has to be inserted once a day, advise the client to use it at night. Why do we do so? Because at night, when the patient is going to bed, that's the right time to insert. And tell them to empty their bladder fully before they insert. Because we do not want a situation whereby someone just inserts, within 5 minutes, they want to urinate, or within 1 minute, I want to urinate. Immediately they stand up, it will come out. And they'll come back to you the following day. That drug you gave me, the whitish things started coming off, but it's the drug. So expect, that's why counseling is important. Expect those white things to come out so that you don't come back tomorrow to say something was coming out. So tell them to insert at night. Sleep or lie down. Oof, certain words are too hard for me to use for my students. Can you forgive me for that?
No, sir.
No, sir. We, for the sake of learning, we want to hear more so that we become good pharmacists. No, sir, won't.
Even anything.
Trisha, some words are too hard for me.
Wait with Trisha because she's the one who even requested for this revision because she needs to understand more than even me and Christophe.
Some words are too hard for me. Okay. So you tell them to say, okay, I'm fading. You tell the client to say, when you write down, you guys, you should read I will send the leaflet for you to read. I'll send you a leaflet.
No,
Help us.
Of course, it doesn't need, they don't need to lift their legs like you were saying. They don't,
Kambani chi funo vera sa.
Nina Nicholas. Ndipe muonekera naonekera.
Like this lecture, how it should be in pharmacy.
I'm failing to proceed. Imagine, yeah. Of course.
So you can just send the note to Sir, we just you are failing to speak.
Okay, I failed.
Missing pharmacy.
Forgive me.
You've joined me now,
Forgive me, I
sir.
failed.
We're in the same boat now.
Derek, help us, Derek.
Hey, may I send a voice note? You want to say this voice note is for Mr. Mdenda, you keep it forever. No. So directions must be very clear on the label on how to use. So okay, I've moved on now. For example, take 2 teaspoons 3 times a day. So on the label, it must be there, and the patient, you can also communicate verbally by telling them that. Then where possible, make sure you avoid writing numbers adjacently. Like you want to say, take 5 meals 3 times a day. You write 5 and then a 3. No, you can write 5 in numeric and 3 times in weights. Take 5 meals 3 times a day. Or you can take 5 meals, 3 and the numeric 3. But avoid where you write 5 without meals, then 3. That 5, 3 may mean 53. Okay, so you avoid certain adjacent numbers to be used or certain numbers to be adjacent. So at all times, for example here, take 2, 3 times a day. So if this 2 is a number and this 3 is a number, it may mean actually 23 to some patients. And the patient will start taking at 0.6, at 7, even 0.6, 37, until 23 times in a day. That's about 23 hours in a day. So they'll finish taking their drug around 23 if they start at 0.0. So make sure numbers or numerics are not written adjacent. Okay. Then liquid preparations usually have their dose expressed as a certain number of 5 ml, like I was saying, 5 mils 3 times a day, or 1 teaspoon 3 times a day, 2.5 mils 3 times a day, and so on. An adult take 10 mils, a child give 2.5 mils, and so on. And remember that 5 mils, give 2.5 mils 3 times a day, and so on, for maybe 5 days or 7 days. If it's an adult, take 2 tablets or take 5 meals or 10 meals once a day or 3 times a day for the required or intended period, maybe 5 days, 7 days, or 15 days or 2 weeks, something like that. All these instructions which are on the label, you also tell the patient verbally on those instructions, okay? Verbally, say take 3 times a day. Because some people, you think that they are reading or they're able to read. Meanwhile, they can't even read. Even those that can read, you make sure you are able to explain to them on how to take a drug, okay? So each extemporaneous preparing or each room where there are products which can be prepared or compounded has to meet certain standards, okay? And these standards in an extemporaneous room must be the same as the standards of a manufacturing company or a manufacturing unit where they are producing drugs at a large scale. So they should have the same standards. Therefore, that room or extemporaneous room, it can be in the dispensary, okay, must ensure that any product that is produced is suitable for use, for human or animal use, okay? And it should be accurately prepared and maintaining the quality assurance of all products that have been prepared, okay? So what standards do you expect to find in such a place? Even when a patient came in, or any person came in, an inspector, a patient, or any person from the public just came in to check in your dispensary where you prepare from certain drugs, they must find the person who is there is adhering to personal hygiene. You're putting on a nice lab coat, and this lab coat is very clean, okay? You don't want to see like the lab coats I see when I go in certain butcheries. Lab coat full of stains, there is a lot of blood. Certain stains, they look yellowish, others they look pink, and so on. For a pharmacy practitioner, we don't want those lab coats. If you have them and you say, no, this one I only use it for the lab when we are going to do labs in Lidway, or I just use them when we're doing dispensing, I've got a clean separate lab coat that I can use when I'm attending to certain patients. No. If you have such a lab coat, please, I repeat, please get rid of it and buy a new lab coat that when you put on, even people around you are going to be motivated. People around you are going to say, okay, this is a pharmacist. Always ensure personal hygiene. Even if other things are not that clean, they are dead, but your lab coat must always be clean. It identifies who you are, and the patients are going to trust you, develop trust in you or not, based on how you look like when you're wearing your lab coat. There must be personal protective equipment. Gloves must be there. For example, in a chemotherapy room, you put on gloves. You put on face masks. Sometimes even there's those headgears. Personal protective equipment must be there. Apron or boots for the pharmacy and so on. Then the equipment and the working environment must be clean as well to avoid contamination. Personal hygiene also avoids contamination to other products. Therefore, clean work environment and equipment to avoid contamination. Then your work area, of course, must be ventilated. It must have ventilators. It must have an AC. That's why you find that certain dispensaries where there are no air conditions or air cons or AC, usually they close them up. So there must be an AC. Must be an adequate area where you're going to do your compounding from. Okay, must be spacious. Okay, and label preparation must be on a certain area where you say this is where the labels are prepared from. It's not everywhere, wherever you want. No. In the compounding room, there must be an area where the label must be prepared. Then weighing and measuring procedure. Those active ingredients you're weighing, of course, you must have scales. Measuring scales for your active ingredient, measuring scales for anything that you want to use, or other apparatus used for measuring volumes. You measure your volumes and so on. So you need to have all these kind of things: cylinders, conical flasks, what do you use to measure the active ingredient? I think we'll look at that later on. So all these things must be in that compounding room. We don't want to see, oh, okay, I measured this 5 milligrams of this tablet and prepare this, but you don't even have a beam balance for measuring products. No ways. Everything must be available. Okay, so if you look at this dispensing environment, you can see this one, a pharmacist. So you find their products here are well put or arranged. They are in order. And this here is a table. That's where they do their compounding from. And that's why you can see here there's, I think there's a mortar and a pestle here. A mortar and a pestle. So all those things you need for compounding can be put in the drawers there, but when you're preparing, you prepare from this table. So in pharmacy, and this defines who we are most of the times, dispensing techniques are well known. How we dispense, I think we've been talking about this, and some of the techniques you guys have been taught where you are doing your dispensing from. All we need is now you guys to improve on those techniques. In the compounding environment or room, the equipment must be situated in the area for intended use. You don't put compounding equipment somewhere else. They must be where they are supposed to be. Like I was saying, in this area, the compounding room, maybe the compounding equipment must be in the drawers there, or they must be readily available on this table. Okay, so every one of you who are working in that environment know where they are supposed to be. They should be clean at all times to prevent contamination. Okay, and make sure that when you use them, each time you use them, you clean them. Each time you use them, you clean them. Okay, and be suitable for the preparation of the desired compounds. They should be clean, dry, at all times, remember I emphasize to prevent contamination. Okay. The equipment also can be used for measuring and weighing products. They should have calibrations. So if it's a volume you're measuring and then there are no marks for volume, how are you going to know that this is 10 mils, this is 100 mils? Okay. After all that, there should be proof of documents. You put documents, you write. Remember, documentation is very important. You document to say, this is what we measured, 5 milligram, you write. We measured 10 mils, we added. That documentation must always be there in the pharmacy. Such that if someone came and they say, I was given an overdose, then you say, no, this is what we used. Because, you know, things can even reach as far as courts. So if it reaches at court level, you say, okay, this is what we used. Okay. So types of equipment are going to find measuring equipment, mixing equipment, molding equipment, and packaging equipment. So you're going to find beam balance for measuring. You find weight containers. Mixing, you find flasks, spatulas, funnels, and prescription bottles, those bottles we're talking about, cups of vials, and so on. You also find mortar and pestle for mixing, mortar and pestle, not just for doing groundnuts and certain foods. In pharmacy, we have what we call, and each one of us, those who qualify as pharmacists before they die, and I hope each one of you, I wish you a long life. When you qualify as pharmacists, when you die, when we'll be burying you, we'll put a mortar and pestle there and offer a pharmacy oath. The oath that you're going to say before you, when we'll be inducting you. After you complete your 5th year, induction day, you do a pharmacy oath. That oath will bury it with you. So you should know that, oh, this oath I'm making today. Mr. iPhone, please, may you mute your phone? Make sure that on that day when you are inducted, that oath, you say we are going to use it when burying you, and we'll give you a mortar and pestle as respect for a pharmacist. Ensure stability of products, okay? Take note of certain things that may affect the stability of a product. Make sure that this product, once stored, it will not change its physical characteristics, chemical characteristics, and so on until the intended period, maybe after 3 years or after 1 year or after 1 month and so on, depending on how you want it to be. The expiration date, I said it must be there, beyond use dates and shelf life. How long are you going to use it on the shelf life? Or beyond dates. For example, this product, it will stay for 4 weeks if it is at room temperature, 25 degrees Celsius. But if you put it at 20 or 15 degrees Celsius, you can use it for some more days. Instead of 28 days, you can use it for maybe 45 days. So those can also be considered as you compound and dispense these drugs. Then assigning a beyond use date. Look at what type of preparation it is. Non-aqueous liquids and solid formulations, the beyond date is not later than 25%. So if it's 50 days, just calculate 25%, how many days, then you add to how it's supposed to be. And you'll find them in the pharmacopoeias, British, USA pharmacopoeia, and so on. Then water containing formulations, the beyond use date should be not later than 14 days when stored at cold temperature. And for all other formulations, the beyond date is not later than the intended duration of therapy, or 30 days. So intended use 30 days. Beyond use for this product, we are saying this cannot still be used after 30 days. Okay. So good dispensing practice refers to the delivery of the correct drug and medical supply to the right patient in the right dosage and quantity. Okay? And that ensures that the potency and quality of that drug is going to be maintained within a specified period and with clear information. What information is it? I think we've been talking about it. Name of the drug, quantity, name of the patient, dosage, and so on. Everything must be clear there. So we go back. When you receive the prescription, remember, you had this in your test. Receive, validate, understand, interpret, label, prepare, final check, then dispense, cancel the patient, make records, record whatever you do in the pharmacy. I saw someone when I was making who said, no, if you don't record because there can be court issues and so on. Yeah, thinking out of the box. Major routes of drug administration, I'm sure you've done this. I'm going to mention them. We have parenteral routes, enteral routes, and other routes. So you go in detail on your own. When you're discussing these, look at the definition of the route, look at the advantages and disadvantages. Okay, for example, oral routes. When you're using, for example, tablets or capsules, they are good for a patient who is conscious. But IV, for someone who is unconscious, it's very good. Okay, so oral route, tablets, capsules cannot be given to unconscious patients. So that's a disadvantage of that route. In terms of patient counseling, it's a point where you offer advice to a patient on their medication and on their condition. We give counseling, or we offer counseling to make sure that the drug is properly taken by the patient. We make sure that the patient does not take the drug wrongly, because if they take it wrongly, there could be issues to do with the adverse effects, treatment failure, drug resistance, and medication errors. Okay, so we have to make sure that we offer adequate patient counseling. So this one is supposed to be medication error. Increase medication errors. Okay, so offer adequate counseling to a patient, and you can follow these 10 behaviors of good counselors. Any pharmacist or pharmacy personnel the patient must establish trust in you. Remember, a coat looking like it's for some beef, and then a client comes to you. Already, so let the clients establish trust in you, because us as pharmacists are the most accessible healthcare professionals. Okay, we should be able to communicate verbally with the patient. Ask them questions about their medication, ask them questions about their condition, ask them, what did the physician tell you? What did they say about your medication, your condition, and so on? Then also learn what we call non-verbal communication. When you're talking to a client, or when the client is talking to you, at least show something that you are able to listen to them. Not where the client is talking, you're also looking somewhere else. It's Peter now, the client is talking. Then Peter is also, Chris, hello, Davison. No. Pay focus on the patient and show that non-verbal communication. Eye contact, look at them in their eyes. Facial expression, tone of your voice, who tell this client and to say, okay, this person is paying attention, that you know, eye contact with the patient. Okay, then patient is asking questions, telling you about their medication or conditions. Pay particular attention, communicate with them, and the communication is actually categorized in two forms. We have this, what we call passive communication, acknowledgement communication, encouragement communication, and active communication. So passive communication, you let the patient talk. Let them talk and talk and talk. But as they are talking, also show the non-verbal communication, eye contact, facial expression, just okay, eye contact, and so on. Then acknowledgement, as they are talking, show you can nod your head. Okay. Then encouragement, okay, yes, go on. You encourage the patient. And the active one is when the patient is talking, you're asking questions, you are talking, you are now interacting. They say this, you say this. Okay, this. That is an active way of communication. Eye contact, be careful.
All right, sir, thank you.
Yes. Then ask questions to the patient, okay? You want to find out more about their condition, more about their medication history, everything you want to find out. Please, as you ask questions, make sure they are open-ended. We don't want questions like yes, no, yes, no, yes, no, yes, no. Those are closed-ended questions where you say, what is your age? Do you drink beer? How often have you been drinking beer? You ask open-ended questions. Open-ended questions makes the patient say what is inside. They'll be telling you. There's no bias. Closed-ended questions, you want your questions to be attended to in the manner you want. But open-ended, the patient will be talking from inside. Whatever they have, they will tell you. And please remain clinically objective. Forget about your personal beliefs. Forget about religious or ethics. Be focused on the patient and be professional. Not, I think, I know traditional medicines that you can use here. I know this will not work. Get the traditional medicine. No. Be objective and be centered on the patient. Show empathy and encouragement. Now, it also depends on how you show this empathy and encouragement. More especially, Peter. Show this empathy and encouragement nicely to a patient or a client. As you show the empathy and encouragement, you are actually going to encourage this patient to adhere to the medication. They will take the medication as you are going to tell them. And you also emphasize to say, if any need arises, call the number for the pharmacy. Peter, call the number for the pharmacy. Please.
Okay.
Call the number for the pharmacy, not say, call me. Call the number for the pharmacy.
Okay, so
Then provide privacy and confidentiality. In a dispensary, there must be a counseling area. Okay? This is what we're saying. There are certain conditions which you cannot discuss in front of everyone. So or if you don't have that, make sure as you're counseling the patient, make sure you go to a distant area, then you lower your voice. Make the patient feel comfortable. Okay? Lower your voice or go in the counseling area and then counsel the patient. Maintain privacy and confidentiality. Who has ever worked in a private hospital or even in public hospital? Who has ever worked in a private pharmacy? No one. Usually patients, they don't want everyone to know their condition. So try by all means to maintain the privacy and confidentiality. And when you are from counseling someone, when you reach, you're out there, the patient goes and you start telling everyone, oh, it's the condition is like this, it's like this. No. Confidentiality must be maintained. Don't say this one, is taking, he or she's taking ARVs. So the ARVs now, she's having reactions. So the skin is like this. No, it's a man, the breasts are now enlarging because of the ARVs. No. Ethics. Let's be ethical. And counseling must be tailored towards individuals or individual needs. A person who is disabled will require a certain kind of counseling. Okay? Very different. Very different from how we are going to counsel someone with HIV, diabetes, TB, or COVID-19. Though if a patient came to Dan and say, okay, I want a painkiller. First, you give a painkiller. Now, as you are giving, and then they tell you to say, I was just discharged yesterday. I was a COVID patient, COVID-19 patient. You can see how people can jump tables and counters, running away. It's just to chill, talk to the patient nicely, make them feel at home in your pharmacy. And if someone is disabled, make sure you understand their condition. Do not make them feel bad that because they are disabled, you know that they are disabled, then things are bad with them. No, make them feel at home, make them laugh or smile and so on. And please motivate patients. Once you motivate them, they will adhere to the medication that has been prescribed. Okay? And lastly, we talk about adherence, compliance, and concordance. Adherence to treatment. This is where a patient or a client is supposed to take the medication as prescribed by the doctor. Exactly the same way, the right amounts. Okay? With or without food, they should be followed. Compliance is a process or a degree. Now, compliance, we're saying it's a process or a degree, meaning it's measurable. Okay? Whereby the patient has to follow the prescribed and dispensed regimen intended by the prescriber or dispenser and dispenser, meaning they follow what they have been told. But after that, you're going to follow up and see, did this patient take the medication? More especially like TB drugs. Did they take the TB drug the way they are supposed to take them? Yes, no. Did they finish the course? No. Then you measure the level of compliance. Is it 25%? Is it 95%? And so on. Then we look we go on concordance. Concordance is where the prescriber, who happens to be a physician most of the time, will sit down with the patient. They talk about the condition. You let the patient tell you what they're suffering from, and then you ask them, which medicine can we give you, this or this? Advantages of this is this and that. Are you able to take this medicine if we give you? Are you able to take this and able to follow the times and so on? Then you agree with the client. That agreement, that is a concordance. Now I tell you, it started with compliance. It used to be compliance. Compliance. So compliance used to be, you give a medication to the patient and you tell them, go and take the way you're supposed to. Okay? Adherence also came in to replace compliance. With adherence, clients would be told how to take, and they will also discuss with the physician. But it also had some challenges. Then came concordance, a new term to replace this, where you find, that's why you find most of the time a client is in the doctor's office, they prescribe, they talk about it. Now, I can assure you, concordance may not be applicable in many cases. Go to the hospital or clinic or any health facility. You go inside there, the physician will just be asking you, and then when they finish, they prescribe. When they prescribe, you have no words. Say, but this medication, what medication is this? They'll be like, so you know about medicines, huh? You know, or they will not ask you, they will not answer you, I mean. They'll feel bad when you ask a question. So concordance, it's quite difficult to implement in these health facilities, more especially here in Zambia. Okay, so like I was saying, concordance has depressed mostly compliance and adherence, but I can assure you, isn't as of today, we more practice compliance and adherence. Compliance and adherence. Concordance very, very difficult to implement. Because imagine the patient has to agree with the healthcare practitioner after a thorough discussion. Okay, this medicine is like this one is like, it's very difficult to implement, but that's what is recommended. Okay, unless there are questions, this marks the end of